Dear students, in lifestyle diseases and prevention subject, today we are going to learn a new topic, breast cancer. Already in our earlier presentation, we have discussed the major properties of cancer cells and we understood what are all the major differences between the normal cells and cancer cells. And we discussed different types of cancers available. In that, breast cancer is a type of cancer. Today we are going to discuss the topic breast cancer in detail. We will understand how to diagnose breast cancer, what are the essential features that need to be known, and the treatment options available and the management practices related to breast cancer. Breast cancer is a cancer that forms in the cells of the breast. After skin cancer, breast cancer is the most common cancer diagnosed in women in the United States and other countries. Breast cancer can occur in both men and women, but it's far more common among women. Substantial support for breast cancer awareness and research funding has helped created advances in the diagnosis and the treatment of breast cancer. Breast cancer survival rates have increased and the number of deaths associated with this disease is steadily declining, largely due to factors such as earlier detection, a new personalized approach to treatment, and a better understanding of the disease. Types. There are different types of breast cancers have been characterized. That includes angiosarcoma, ductal carcinoma in situ, inflammatory breast cancer, invasive lobular carcinoma in situ, male breast cancer, Paget's disease of the breast, and recurrent breast cancer. Now we will discuss the major symptoms of breast cancer. Nipple changes. Some symptoms of the breast cancer may include a breast lump or thickening that feels different from the surrounding tissue. Change in the size, shape, or appearance of the breast. Changes to the skin or the breast such as dimpling, a newly inverted nipple, peeling, scaling, crusting, or flaking of the pigmented area of the skin surrounding the areola or breast skin. Redness or patching, pitting of the skin over the breast like the skin of an orange. When to see a doctor? If any individual finds a lump or other changes in the breast, even if a recent mammogram was normal, please do discuss with the medical physician for more information. What are the major causes for breast cancer? Doctors know that breast cancer occurs when some breast cells begin to grow abnormally. These cells divide more rapidly than healthy cells do and continue to accumulate, forming a lump or mass. Cells may spread, that is metastasis, through your breast to your lymph nodes or to other parts of the body. Breast cancer most often begins with the cells in the milk producing ducts. Breast cancer may also begin in the glandular tissue called lobules or in other cells or tissues within the breast. Researchers have recently identified hormonal, lifestyle, and environmental factors that may increase the risk of breast cancer. But it's not clear why some people who have no risk factors develop cancer, yet other people with risk factors never do. It's likely that breast cancer is caused by a complex interaction of your genetical makeup and your environmental factors. Inherited breast cancer. Doctors estimate that about 5 to 10% of breast cancers are linked to gene mutations passed through generations of a family. A number of inherited mutated genes that can increase the likelihood of breast cancer have been identified. The most well-known breast cancer gene 1, BRCA1, and the breast cancer gene 2, BRCA2, both of which significantly increase the risk of both breast and ovarian cancer. If you have a strong family history of breast cancer or other cancers, your doctor may recommend a blood test to identify specific mutations in the BRCA or other genes that are being passed through your family. What are the other risk factors? A breast cancer risk factor is anything that makes it more likely you will get breast cancer. But having one or even several breast cancer risk factors doesn't necessarily mean you will develop breast cancer. Many women who develop breast cancer have no known risk factors other than simply being women. Factors that are associated with an increased risk of breast cancer include being female. Women are much more likely than men are to develop breast cancer. Increasing age. Your risk of breast cancer increases as you age. A personal history of breast conditions. If you have had a breast biopsy that found lobular carcinoma in situ or atypical hyperplasia of the breast, you have an increased risk of breast cancer. A personal history of breast cancer. If you have had breast cancer in one breast, you have an increased risk of developing cancer in the other breast. A family history of breast cancer. If your mother, sister or daughter was diagnosed with this, particularly at a young age, your risk of breast cancer is increased. Still, the majority of people diagnosed with breast cancer have no family history of the disease. Inherited genes that increase the cancer risk. Certain gene mutation that increase the risk of breast cancer can help to be passed from parents to children. The most well-known gene mutation are referred to as BRCA1 and BRCA2. These genes can greatly increase the risk of breast cancer and other cancers, but they don't make cancer inevitable. Radiation exposure. If you received radiation treatments to your chest as a child or young adult, your risk of breast cancer is increased. Obesity. Being obese increases your risk of breast cancer progression. Beginning your period at a younger age. Beginning your period before age 12 increases your risk of breast cancer. Beginning menopause at an older age. If you began menopause at an older age, you are more likely to develop breast cancer. Having your first child at an older age. Women who give birth to their first child after age 30 may have an increased risk of breast cancer. Having never been pregnant. Women who have never been pregnant have a great risk of breast cancer than do women who have had one or more pregnancies. Postmenopausal hormone therapy. Women who take hormone therapy medications that combine estrogen and progesterone to treat the signs and symptoms of menopause have an increased risk of breast cancer. The risk of breast cancer decreases when women stop taking these medications. Drinking alcohol. Drinking alcohol also increases the risk of breast cancer. What are the available prevention procedures? Breast cancer risk reduction for women with an average risk. Ask the doctor about breast cancer screening and go for the suggested examinations. Become familiar with your breast through breast self-exam for breast awareness. Women may choose to become familiar with their breast by occasionally inspecting their breast during a breast self-exam for breast awareness. If there is a new change, lump, or other unusual signs in your breast, then it has to be discussed with the doctor. Breast awareness cannot prevent breast cancer, but it may help you to better understand the normal changes that happens and identify any unusual signs and symptoms. Drink alcohol in moderation if at all. Limit the amount of alcohol intake and to no more than 1 drink a day if you choose to drink. Exercise most days of the week. Aim for at least 30 minutes of exercise on most days of the week. If you haven't been active lately, ask the doctor whether it's okay or start slowly. Limit postmenopausal hormone therapy. Combination hormone therapy may increase the risk of breast cancer. Talk with the doctor about the benefits and risk of hormone therapy. Some women experience bothersome signs and symptoms during menopause, and for these women, the increased risk of breast cancer may be acceptable in order to relieve menopause signs and symptoms. To reduce the risk of breast cancer, use the lowest dose of hormone therapy possible for the shortest amount of time. Maintain a healthy weight. If your weight is healthy, work to maintain that weight. If you need to lose weight, ask the doctor about healthy strategies to accomplish this. Reduce the number of calories you eat each day and slowly increase the amount of exercises. Choose the healthy diet. Women who eat a Mediterranean diet supplemented with extra virgin olive oil and mixed with nuts must have a reduced risk of breast cancer. The Mediterranean diet focuses mostly on plant-based foods such as fruits and vegetables, whole grains, legumes, and nuts. People who follow the Mediterranean diet choose healthy fats such as olive oil, or butter, and fish instead of red meat. Breast cancer reduction for women with the high risk. Preventive medications, that is chemoprevention. Estrogen blocking medications such as selective estrogen receptor modulators and aromatase inhibitors reduce the risk of breast cancer in women with a high risk of the disease. These medications carry a risk of side effects, so doctors reserve these medications for women who have a very high risk of breast cancer. Preventive surgery. Women with a very high risk of breast cancer may choose to have their healthy breasts surgically removed. Preventive surgery. Women with a very high risk of breast cancer may choose to have their healthy breast surgically removed. That is called prophylactic mastectomy. They may also choose to have their healthy ovaries removed. That is called prophylactic oophorectomy to reduce the risk of both breast cancer and the ovarian cancer. Now we will discuss the diagnostic procedures available for the diagnosis of the breast cancer. Breast MRI scanning, breast exam. Tests and procedures used to diagnose breast cancer include breast examination. The doctor will check both the breast and lymph nodes in the armpit, feeling to any lump or other abnormalities will be screened out. Mammogram. A mammogram is an X-ray of the breast. Mammograms are commonly used to screen for breast cancer. If an abnormality is detected on a screening mammogram, the doctor may recommend a diagnostic mammogram to further evaluate the abnormality. Breast ultrasound. Ultrasound uses sound waves to produce images of the structures deep within the body. Ultrasound may be used to determine whether a new breast lump is a solid mass or a fluid-filled cyst. Removing a sample of breast cells for testing, that is biopsy. A biopsy is the only definite way to make a diagnosis of breast cancer. During a biopsy, the doctor uses a specialized needle device guided by X-ray or any other imaging test to extract a core of tissue from the suspicious area. Often, a small metal marker is left at the site within your breast so that area can be easily identified on future imaging tests. Biopsy samples are sent for the laboratory analysis where the experts determine the cells are cancerous or not. A biopsy sample is also analyzed to determine the types of cells involved in the breast cancer, the aggressiveness of the cancer, and whether the cancer cells have hormone receptors or other receptors that may influence your treatment options. Breast magnetic resonance imaging. An MRI machine uses a magnet and radio waves to create pictures of the interior of the breast. Before the breast MRI, they may receive an injection of dye. Unlike other types of imaging tests, an MRI doesn't use radiation to create the imaging. Staging breast cancer. That is, we'll know what are all the different stages of breast cancer. There are certain tests and procedures have been characterized to stage breast cancer. That includes blood tests such as complete blood count, mammogram of the other breast to look for signs of cancer, breast MRI, bone scan, CT scan, and positron emission tomography scan. Not all women will need all these tests and procedures. The doctor selects the appropriate test based on the specific circumstances and taking into account for new symptoms that may be experienced. Breast cancer stages ranges from 0 to 4, with 0 indicating cancer that is non-invasive or contained within the milk ducts. Stage 4 breast cancer, also called metastatic breast cancer, indicate cancer that has spread to other areas of the body like lungs. Breast cancer staging also takes into account your cancer's grade, the presence of tumor markers such as receptors for estrogen, progesterone, and HER2, and proliferation factors. Treatment. There are different types of treatment procedures are available, so we'll discuss one by one. The first one is the breast cancer surgery. Removing the breast cancer during a lumpectomy, which may be referred to as a breast conserving surgery or wide local excision, the surgeon removes the tumor and a small margin of surrounding healthy tissue. A lumpectomy may be recommended for removing smaller tumors. Some people with larger tumors may undergo chemotherapy before surgery to shrink a tumor and make it possible to remove completely with a lumpectomy procedure. Removing the entire breast, that is mastectomy. A mastectomy is an operation to remove all your breast tissue. Most mastectomy procedures remove all of the breast tissue, the lobules, ducts, fatty tissues, and some skin, including the nipple and areola. New surgical techniques may be an option in selected cases in order to improve the appearance of the breast. Skin sparing mastectomy and nipple sparing mastectomy are increasingly common operations for breast cancer. Removing a limited number of lymph nodes. To determine whether cancer has spread to your lymph nodes, the surgeon will discuss with the patient and the role of removing the lymph nodes that are the first to receive the lymph draining from the tumor. If no cancer is found in those lymph nodes, the chance of finding cancer in any other remaining lymph node is small and no other nodes needed to be removed. Most women with breast cancer in one breast will never develop cancer in other breast. Complications of breast cancer surgery depend on the procedures that the doctor follow. Breast cancer surgery carry a risk of pain, bleeding, infection, and arm swelling. radiation therapy. Radiation therapy uses high-powered beams of energy such as X-rays and protons to kill cancer cells. Radiation therapy is typically done using a large machine that aims the energy beams at the body, but radiation can also be done by placing radioactive material inside your body. External beam radiation of the whole breast is commonly used after a lumpectomy. Breast brachytherapy may be an option after lumpectomy if you have a low risk of cancer recurrence. Breast cancer radiation can last from 3 days to 6 weeks depending on the treatment. Side effects of radiation therapy include fatigue and a red sunburn-like rash where the radiation is aimed. Breast tissue may also appear swollen or more firm. Rarely, more serious problems may occur, such as damage to the heart or lungs, very largely second cancer in the targeted area. Chemotherapy. Chemotherapy uses drugs to destroy fast-growing cells, such as cancer cells. If your cancer has a high risk of returning or spreading to another part of your body, the doctor may recommend chemotherapy after surgery. Chemotherapy is sometimes given before surgery in women with large breast tumors. The goal is to shrink the size of the tumor that makes it easier to remove with surgery. Chemotherapy is also used in women whose cancer has already spread to other parts of the body. Hormone therapy. Perhaps more properly termed hormone blocking therapy is used to treat breast cancer that are sensitive to hormones. The doctors may refer to these cancers as estrogen receptor positive and progesterone receptor positive cancers. Hormone therapy can be used before or after surgery or other treatments to decrease the chance of you getting cancer returning. If the cancer has already spread, hormone therapy may shrink and control it. So that's all, students. The detailed information about the breast cancer, how it is being progressed in the human body, how can we diagnose with the different techniques, and what are all the preventive procedures available, and the treatment options available in the modern day scientific community. So in the next class, we will discuss a new topic with more information. Thank you. Thank you. Thank you. Thank you. Thank you.